Okay, good evening, everyone. Just going to allow a minute or two for everyone to join. So for those who haven't met me before, my name is Muhibur Rahman. I'm a portfolio GP, which means I'm a GP with different roles. I've got clinical roles, I'm a partner in my own practice, I work as a locum in various other NHS practices, I cover 2 different community detox units, and I've held various other clinical roles over the last 24 years that I've been working as a doctor. It'll be 24 years in August. My main role now, though, is I'm the medical director of eMedica. So mostly my time is spent developing and running courses. We run courses to help people get into training for lots of different specialties. So MSRA preparation courses, we run interview skills courses, courses focusing on SJT. And then for those in GP training, we run courses for all of the membership exams. MRCGP AKT, MRCGP SCA. I used to be an examiner and invigilator for the GMC, for their PLAB OSCE. I sit on the NICE GP reference panel, and I've held various other consulting roles and written lots of books and articles about specialty training, GP careers, MRCGP. Our team at eMedica have now trained since it's going to be our 20th year of running courses in August this year, and we've trained over 83,000 delegates in that time. Joining me today as faculty to help deal with some of the queries from the core eMedica team, we've got Tuba Jamil. Okay, so how it's going to work today, this is strictly a question and answer session. So what I'm going to do is we're going to open up questions in the Q&A. Because there's lots of people, we will not be taking any questions that are asked in the chat. So please don't type any questions in the chat. Before you start asking questions, I'm going to give answers to 5 of the really common questions that I've been asked since applications opened and even before. And if you go on our YouTube channel, and Tuba will post a link to our YouTube channel, please watch. I filmed a whole video looking at frequently asked questions about round 3. So, you'll find a lot of answers there. But I'll cover some of those right now. And then any other questions, I'll pick up from the Q&A. We've got strictly until 8:30, and then it will end. So we'll get through as many questions as we can in that time. If I don't manage to answer any questions that are still left over, you can send a message or drop an email to the team. Okay, so let's look at some of the really common questions. The first question I often get asked is, what specialties are recruiting in round 3? So round 3 is the round that's open now, opened yesterday. It will close August 14th to applications. Only 3 specialties are recruiting at ST1 and CT1 level in this round. They are GP, psychiatry, and anesthetics. The other specialties tend to only recruit once a year in round 1. Applications for that will open in October, with the exams for MSRA January, February. That's the first common question. Which specialties? Next one I get asked is, is this round more competitive? How many jobs will there be? It's much more competitive. To give you an idea, GP in round 1 has over 4,000 jobs. GP this round has 662 jobs. So it's like 15% of the jobs compared to round 1. Psychiatry in round 1 has 400 jobs. There's, just over 100 jobs at the maximum end. At the minimum end, about 75, 80 jobs. And anesthetics hasn't announced how many jobs, but typically it's a handful of jobs in round 3. Okay, so it's much, much more competitive in this round. Next question I get asked, have there been any changes to eligibility or prioritization UK graduates compared to international graduates? No, there are no changes at all for this round. Would there be potentially changes in future rounds? Potentially, but until something official is published and we know the details of it, it's pointless wasting time conjecturing. Okay. Currently, there are no changes to eligibility. So what is the eligibility? To be eligible to apply for training, you must have, by the start date, so by February 2026, you must have 2 years clinical experience. So internship plus 1 more year. You must have full GMC registration and a license to practice by the start date of training. You don't need that at the time of application. So, let's say right now you've got 18 months of experience and you're in a job and will be in that job until February. By February, you will have 2 years, won't you? That's fine, you're eligible. If you will not have 2 years experience by February, you're just not eligible for this round. There's no point even submitting an application. That's just spending time for no benefit. Instead, focus on getting more experience and apply next year. Okay. You must submit evidence of foundation competencies in one of the acceptable methods at the time that you apply. You can't submit it later. Okay. So that's another common question I got asked. Then another really common question is, if I sat the exam in round 1, can I resit or can I apply in this round? So you can definitely apply. However, whether you will be given a slot to resit or not, you won't know until late August. And that's because, for those of you that have already started filling the application, you will see that there's a specific mention that if you're asking to resit, priority will be given to those that are applying and sitting the exam for the first time. So what will happen is, once everyone's applied, they'll know how many people have applied. Anyone that's sitting for the first time, they're going to get a slot. Okay. Then they're going to look at how many people that want to resit are there and how many slots there are. And if there's slots for everyone, then great, you'll all be able to sit. If there aren't slots, then what they might do is what they did last year. So last year, everyone applying for the first time got a slot. People that sat in first round and failed got a slot. People that passed in round one but didn't get a particularly good score, they were not allowed to resit. There just weren't enough slots. They were just told, you can't resit, but they were allowed to use their existing score. Okay. So those are probably the most common questions that I guess asked. And then one more really common question is, if I applied before and I used a CREST form, can I use the same one again? So as long as it's CREST 2024, there's two versions of CREST 2024, one with the date 2023 on it, one with the date 2024 on it, as in when it was published, but it still says CREST 2024. As long as it is that version, and as long as the competencies are in date, then you can use the same form, but you will need to attach updated evidence that your consultant is a consultant, has a license to practice with the equivalent medical council that they're working in. So for example, let's say they're working in Bangladesh. Then you'll need evidence that they're registered with the Bangladesh Medical and Dental Council and have a current license to practice, and that they are a consultant on the specialist register equivalent. If they are working in the UK, and you got it signed from a UK job, you just put their GMC number and they'll be able to check that they're on the specialist register. If they're not on the specialist register, that won't be accepted. So for example, there are some locum consultants who aren't on the specialist register. They can work as a locum consultant, but unless they're on the specialist register, if they sign a CREST form, it will 100% be rejected. Okay, so those are the really common questions. Anyone that asks that question, I'll ask Tuba just to remove those questions so we don't, use up the time covering things I've already answered. Any other questions, please ask them in the Q&A, and we've got 20 minutes left. I'll just clear those and we'll go through them. Okay. Someone's asked, is it worth ticking the box to carry the MSRA score forward when they don't know how good the score will be? Well, if you choose to carry over, you won't be given a slot. You will have no chance of resitting. So is it worth carrying over? Only if your score is excellent, because round 3 is always much more competitive than round 1. So what score was it worth carrying over? For GP, I'd say that if you've got a score of 550 and above, that's going to be competitive, definitely worth carrying that over, no need to resit. If you've got a score of 520 and above, there's some chance that you might get a job eventually. That might be enough by the end, but it might not be, because it's getting more and more competitive. I'd say anything less than 520 for GP, you definitely want to resit. For psychiatry, 520 is probably not going to be enough, and you'd want to resit unless you've got 550 plus. Okay. Similarly for anesthetics. Okay. But if you choose to carry over, you will not get a slot to resit. If you choose to resit and then they can't give you a slot, your score will automatically carry over. Okay. Someone said, how long does it take to prepare for the exam? It's a great question. The answer for that is going to be different for different people. Because remember, it's not a simple pass-fail exam like, say, MRCP or PLAB or MRCS. This is a competitively ranked exam. Okay. So you are competing with thousands of other people that want that job. Some of those will have been preparing for this exam already for 3 months, some for 6 months. So there'll be some people that are starting now after, their applications have opened. You're competing with all of those other people. And your score isn't based on just what do you score out of 100%. It's how do you score compared to everyone else that applied. That's what will determine your standardized score. So how long does it take? Some people can do it in 2 months. Some people can spend 6 months and they'll be prepared. Others will spend a year and they still won't get a competitive score, because it also depends on your existing knowledge, your familiarity with NICE guidelines, your other UK clinical guidelines, your familiarity with GMC ethical guidance, with situational judgment test questions. The main thing I would say is just start early, do as much as you can. And that's all anyone can ask, right? And then hopefully it's enough. For some people, they might sit it 2, 3, 4 times before they get a competitive score. Others, first time, they're going to get a competitive score and get their first choice job. Okay. Someone's asked, is a job as a demonstrator or lecturer full-time count as clinical experience? No, that would count as a career gap. Similarly, any work where you're not actually seeing patients. So, if you're working as a lecturer, you're working as a researcher, you're working, while it might be clinical research, but you're not seeing patients, you're doing research. All of that's a career gap. Similarly, any unpaid observerships, any clinical attachments, these are all career gaps. They're not counted as experience. They won't count towards the 2 years clinical experience. They go in the gap section. Okay. And someone said, what if you're working as a medical officer as well? Well, if you're working as a medical officer, that's clinical experience. You put that down as experience. Someone asked, what is CCT Combined Program? CCT Combined Program is for doctors that have other relevant experience and want to use that experience to shorten their training by usually up to 6 months. So if you've got experience in another training program in the UK, one of the options for CCT is called the ATC program. And you could shorten your training by 6 months. Let's say if you've done psychiatry training in the UK. If you've got relevant experience outside of the UK or in a non-training post in the UK, then you can apply for the combined program CCT. And again, if you can then show, if you've got evidence to show how the things that you did in that job map to the RCGP curriculum and competencies, so you have to fill in a whole load of paperwork, hundreds of pages of paperwork typically, then you may get up to 6 months reduction in your training. One thing to be aware of, if you do this, you won't get a standard CCT when you finish training. You will get CCT CP. If you're going to work in the UK, that's fine. It's recognized in exactly the same way. But if you plan to work in other countries, like say Australia or Canada, they won't recognize CCT CP in the same way. Okay. So whether it's worth doing depends if that's something that's important to you and whether you want to go through and have all of that paperwork to get a reduction of 6 months. Someone asked, if I sit this time, can I sit again in round 1? Yes, sitting in September has no impact on eligibility for round 1 if current rules stay in place. Okay. Someone said, is a career gap fatal? No, you can have multiple career gaps. As long as they're well explained and outside of the career gaps, you still meet the experience, they make no difference whatsoever. Someone said, isn't 3 months post-internship experience enough to apply for ST1 GP? No, you won't meet the 2-year experience requirement. You might be confusing that with that 3 months full-time is enough to get the CREST form signed. That's a separate criterion to meeting the 2 years clinical experience. Do huge gaps of about 2 years affect my chances of getting an offer? No, as long as you still meet the eligibility, all that matters is your score. Okay. Someone's asked, do I need to rank places with 0 places? If you'd be interested in that place, you can rank it. It may stay at 0. That's what usually happens, in which case it doesn't affect you. But sometimes later on, job numbers change. So you might find that a place with 0 suddenly has 1 job. If you hadn't ranked it, you wouldn't be considered for it. If you'd ranked it, you may be considered for that place. Someone said, what's the expected cutoff score for GP in round 3? I think it'd be over 520, but it could be much higher. Someone said in the preferences, most places have August written by them. That's a mistake. When you actually click it, you'll see the jobs for this round start either in February or a few start in April. Most start in February. Someone said, please can you guide how and where do I apply for obstetrics and gynecology? They only recruit, this year they're not recruiting in round 3, so they will recruit in round 1. You will apply in Oriel and you will apply in end of October and the MSRA will be January, February. You should start preparing for MSRA from now though, because it's going to be very, very competitive. Okay. So a couple of people had asked about how to maximize preparation. Okay, let me just share my screen and tell you about what we offer. This is the eMedical website. So all the things we offer for MSRA, if you click this, it shows you them. So our most comprehensive preparation is our MSRA Crammer Course Bundle. So if you click this, it's got details. For this round, you can access the recorded version. Okay, we run the live session in November or December prior to round 1. But if you click subscribe now, you get access to the full 2-day course recording. That's over 14 hours of video. So over 7 hours covering the clinical paper, over 7 hours covering the SJT paper. So you'll be able to cover over 100 clinical guidelines efficiently. You'll do a full clinical mock with exam timings, with detailed reviews of over 100 clinical guidelines. You'll cover for the SJT. How do SJTs work? How are they marked? How to approach different types of SJT? Something really important. The SJT is more technique than knowledge. So there's a big focus on the technique. And then we'll go through 40 high challenge, high yield SJTs in depth. And for each one, we understand why is the right answer, so that you actually can then apply those techniques to any SJT, but you'll also sort of cover the key knowledge. So we'll cover the important GMC and ethical guidance that you need to know. And one of the things that this course is helpful for, I'd say there's three groups of people that's primarily helpful for. One is someone who's already done a lot of preparation, but maybe you are only applying to a few places, or you're applying to a specialty where you need a really high score and you just want to do everything you can to squeeze out every extra competitive percentage. Okay. That's one group. Another group is people who maybe couldn't start as early as you wanted to, and you now would like to cover a lot of material in a short time efficiently. And the last is people who maybe have sat it once, twice, multiple times, and particularly need help with exam technique. Because if you've sat multiple times and your score isn't really improving, it's not that you're not working hard, you've probably done thousands of questions, but it suggests that maybe your exam technique and your approach to questions might be lacking. And especially for the SJT, that can make a huge difference. You can see this doctor got 627, got an offer in ophthalmology. You can see this doctor got a 551, got into radiology. You can see examples of someone who was 611, got into psychiatry, 595, got into radiology, CST, 587, anesthetics, 587, 584. And one of the things, we've had a lot of people who sat it, might have had a decent score, but really wanted to do everything to improve. We had one doctor add 70 marks to their score from one year to the next. Okay, so you just click subscribe now. You can subscribe anywhere from 1 month, which is £449. That gives you access to all of the recordings for day one and day two, our question bank, which has 2,290 plus questions, and mini mocks and full mocks. Okay, so if you want to do this is our most comprehensive preparation. If you've already got a good handle on a lot of the topics and you just want lots of practice questions, then if I take you back, underneath that we've got our question bank. So if you just need questions, you don't need the teaching, you don't need the recordings, the videos, then, and you've got lots of time to do the work, you can subscribe to just the questions without the recordings. Okay, and that starts anywhere from £49 for 1 month up to £129 for a year. Okay, so they're the key resources that we've got. And then if you want to cover some clinical guidelines efficiently, if you go into our book section, we have our clinical case cards. The physical cards are actually sold out at the moment. Okay, so what you can do is subscribe to the digital version, and this allows you to cover there's 112 topics. They're up to date, and it's an efficient way to sort of cover nice guidelines. Okay, so that's all on the eMedica website. Someone said that they were unsuccessful in the first round. They're successful in this round and they don't get an offer. What will happen in January? You won't be able to transfer the score unless it's for GP. GP is the only one you can transfer your score for up to 12 months. Every other specialty, whatever your score is in round 3, it dies in round 3. In round 1, even if you had a great score, for any other specialty, you'd have to reset. You can't carry scores over from round 3 to the next recruitment year, except for GP. Okay, so you'd apply and you'd sit the exam in January, February. How long will it take the Oriel team to longlist candidates? So you will get an email to tell you if you can book the MSRA or not after longlisting is completed. The date they've given for that is expected the 21st of August. Okay. Someone said, will the question banks from eMedica be enough? If you're just doing the questions, if you've already got a good handle, good knowledge base, then I would say, that might be enough for you. If you finish and you've got time, I'd recommend get exposure to some more clinical questions by adding another question bank. If you are less familiar with GMC ethical guidance, UK clinical guidelines, if you haven't got much exposure to SJTs in the past, then I would say that just doing questions, whether our question bank or any other question bank, may not be enough for you. You would benefit from teaching to actually understand how to approach SJTs to cover the guidelines efficiently. Okay, especially if you've left it late. If you'd started 6 months ago and could have lots of time to do all of the reading yourself, that might be fine. And if you're starting early for next year, that might be fine. But if you're trying to cover a lot in a short time, then I'd say that you benefit from the course as well, because those videos allow you to cover a lot of material in an efficient way. Okay, someone said, could you clarify whether postgraduate clinical experience must be paid to be considered eligible. Yes, so voluntary role work, unpaid roles like observerships, these are all considered career gaps, not employment, okay? Someone said, I've crest form signed, but I moved to a different trust. Should I get a new crest form signed? No, the competencies are still in date. There's no need. You can use that one. Okay, great. And that's the last question. And we've just gone past 8:30. So really, to say two things just before we end. First of all, huge thank you to Tuba for moderating, acting as faculty, helping me to clear the questions. And to all of you for joining this evening. You've asked some great questions. I hope you found it helpful. But really, what I would say, look, whether you've been preparing for months, whether you're just starting to prepare now, please just do as much as you can. That's all anyone can ask. We've got 5 weeks to the exam now, right? Just over. All right. Make every day count. All right. Don't delay any further. If you haven't already started, just start now. If you start now, you can do 3 hours every day. That still gives you time to do 120 odd hours of study. Okay. If you wait until they contact you in August 21st to say you've got a space or not, you almost certainly won't have enough time to prepare effectively because you're competing with people who've been preparing for months. You only have 2 weeks at that time to the exam. Okay. So, please make a start now and just do as much as you can. All right. And no one can ask you to do more than that. Right. And then if something's meant for you, the whole world can't keep it from you. And if something's not meant for you, the whole world can't bring it to you. Okay. All anyone can do is do as much as they can. And that's what you should do. Be hopeful, work hard, prepare, and you will succeed. So I hope you found it helpful today. If you got any questions, any other queries, you can always send me a message, drop me an email. And whether you use eMedica or use other resources or use us and other resources, our whole team wishes you every success.